Welcome to The Explainer. Today, we're diving into comprehensive dental college lecture notes that are going to completely flip how you think about oral hygiene. Forget what you know about simply cleaning your teeth. We are turning this from a totally boring, mundane chore into what it really is, a high-stakes, strategic battle against a highly organized microscopic enemy.
Okay, let's dive into this. For a long time, dentistry was basically a surgical model, right? You see a hole, you drill a hole, you fill a hole. But check out this quote that perfectly captures the massive paradigm shift in modern dentistry. Restorative dentistry treats the symptom, preventive dentistry treats the cause. We're moving way away from just reacting to damage and moving toward actively intercepting the disease before it even has a chance to take hold.
Which brings us to Phase 1. Know your enemy.
Every great strategy begins with understanding exactly what you're up against. So let's set our sights on the primary antagonist of your mouth, plaque. Isn't just a random collection of leftover food from lunch. No, it's a biofilm. That's a highly structured community of bacterial cells, fully enclosed in a self-produced sticky matrix. Think of it less like dirt and more like a microscopic, heavily armored city attached to your teeth. These bacteria literally cooperate with each other inside this matrix, making them up to 1,000 times more resistant to antimicrobials than free-floating bacteria. So we can't completely sterilize the mouth, and honestly, we shouldn't even try. Our mission here is disruption.
And here is your ticking clock. 24 to 72 hours. That is the absolutely critical time window. If you leave this biofilm undisturbed for that period, it matures. It literally mutates from harmless bacteria into acid-producing, bone-destroying pathogens. And that is exactly why our daily goal isn't just, freshening our breath. It's the physical, mechanical disruption of this armored matrix before it reaches pathogenic maturity.
All right, let's move into Phase 2, mechanical combat.
Now you might be thinking, hey, I'll just scrub harder with a really stiff brush. Actually, scratch that, that's a terrible idea. The universal clinical standard is a soft brush with 0.15 to 0.2 millimeter end-rounded bristles. Why? Because hard bristles don't actually remove more plaque, but they will absolutely tear your gums up and lead to permanent recession. And how you wield that soft brush matters immensely. The gold standard for adults is the modified Bass technique. You don't just scrub around randomly. You angle the bristles exactly 45 degrees, pointing right into the gum line. You gently vibrate to break up the biofilm and then sweep it away. Contrast that with the phones technique, that big circular scrubbing motion we all learned as kids. It's great for children or anyone with limited dexterity, but for adults, it completely misses the deep cleaning we desperately need.
And this brilliantly illustrates a huge gap between clinical science and human behavior. The clinical standard for brushing is 120 seconds, a full 2 minutes. The reality? Most of us are barely hitting 30 seconds. I know I've been guilty of it. We're basically abandoning the battlefield early. Oh, and here's a massive pearl of wisdom from the clinical notes. Spit, don't rinse. Seriously. When you rinse with water right after brushing, you're washing away all those concentrated protective ingredients. Just spit the excess out and let the paste do its job.
Moving on to Phase 3, the interdental vulnerability. See, even if your brushing technique is absolutely flawless, you're still missing a massive 40% blind spot where a toothbrush bristle physically cannot reach. Specifically, we're talking about an area called the coal. The coal is the saddle-like depression right between your teeth. What's genuinely terrifying about the coal is its biology. It's covered in non-keratinized tissue. Keratin is essentially armor for your gums, and the coal simply doesn't have it. It is literally the most undefended territory in your entire mouth. To put that vulnerability into perspective, a staggering 90% of periodontal bone loss and cavities between the teeth start right here in this hidden, undefended little valley. 90%. That is exactly why brushing alone is biologically and mathematically insufficient to win this war.
So, how do we defend it? Well, unwaxed dental floss is fantastic for tight contacts between teeth, and you know you're winning the battle when the floss literally squeaks against a clean tooth. That means you've successfully scraped away the biofilm. But if someone already has bone loss creating open spaces between their teeth, interdental brushes are actually statistically superior to floss for removing that plaque. And what if you have braces or implants? Water flossers are going to be your absolute best friend, using hydrokinetic flushing to blast all that debris away.
Let's transition to Phase 4, chemical defense.
So the crucial point is, mechanical disruption is our infantry, right? Now we need to bring in the chemical artillery. This is all about fortifying the physical structure of your teeth against acid attacks.
Your natural enamel is made of a crystal called hydroxyapatite, which starts dissolving when your mouth's pH drops to 5.5, like right after you eat sugar. But when you apply topical fluoride, it physically replaces the hydroxyl ions in your teeth to create a brand new, supercharged crystal called fluorapatite. And get this, fluorapatite doesn't start dissolving until the pH hits a much more acidic 4.5. You are quite literally upgrading the molecular armor of your smile.
Now, this chemical arsenal comes in drastically different strengths. Community tap water provides a great baseline defense at 0.7 parts per million. Your standard over-the-counter toothpaste bumps that up to about 1,000 to 1,500 parts per million. Dentists can even prescribe pastes at 5,000 or paint on professional varnishes at a whopping 22,600 parts per million. But here is a fascinating warning straight from the notes. If a dentist uses an in-office 1.23% acidulated phosphate fluoride gel, it's so incredibly acidic it can actually etch and melt porcelain crowns and titanium implants. Wild, right? You absolutely have to know which chemical you're deploying.
Next up, Phase 5, Physical Armor.
So fluoride works wonders on the smooth sides of your teeth, but your chewing surfaces, especially your molars, they need a totally different strategy because of a crazy anatomical trap. Think about this. A standard toothbrush bristle is about 0.2 millimeters thick, but the deep, microscopic fissures on top of a molar can be less than 0.1 millimeters wide. The bristle physically cannot fit inside to clean out the bacteria. No way! Because of this size mismatch, these chewing surfaces account for over 80% of cavities in kids, even though they make up barely 12% of the tooth surfaces. It's just a perfect, oxygen-free hiding spot for the enemy.
The clinical fix for this is a pit and fissure sealant, but the application process is ridiculously strict. You clean the tooth, sure, but step 2 is make or break, isolation. You need absolute moisture control. Then you etch the tooth with 37% phosphoric acid, apply the sealant, and use a light to cure it. Here's the kicker. If even a single drop of saliva touches that tooth after the acid etch, the bond strength of the sealant instantly drops by up to 90%. But when it's done flawlessly, you've completely bricked up the bacteria's favorite hideout.
Which brings us to our final phase, Phase 6, the mind game.
We've talked biology, we've talked tools, we've talked chemical weapons. But the final and honestly the most difficult phase of all this is human psychology. There's a profound truth in these notes. Knowledge does not equal behavior change. People know they should brush and floss. You definitely knew that before watching this explainer. But just lecturing someone with anatomical facts doesn't magically change their routine when it's 11 p.m. and they just want to go to bed.
Let's see how professionals overcome this hurdle. Instead of the classic finger-wagging guilt trip, modern pros use something called motivational interviewing, specifically the OARS technique. That stands for open-ended questions, affirmations, reflective listening, and summarizing. It's entirely collaborative. It's all about guiding someone to find their own internal motivation to disrupt that biofilm, rather than just barking rules at them. And to really bridge the gap between knowing and doing, dentists use the tell, show, do method paired with disclosing dyes. This is so cool. These dyes literally paint the invisible enemy. Pink or red dye shows fresh plaque that's less than 24 hours old. But if you see blue or purple dye, that reveals dangerously mature, undisturbed enemy bases that have been entrenched for over a day. It is undeniable, in-your-face visual proof of exactly where your daily defenses are failing.
Which brings us to the ultimate question. Are you treating the symptom or defeating the cause? Every single time you pick up a toothbrush, you aren't just doing a boring chore. You're stepping onto a microscopic battlefield. I really hope this explainer has inspired you to evaluate your own routine, optimize your strategy, and take up arms against the real root cause of dental disease. Keep learning, keep disrupting that biofilm, and go win that war in your mouth.